Okay, so I wanted to do a short and brief workout for anyone out there who might be recovering from hysterectomy surgery, or any kind of abdominal surgery really. And obviously when we have that experience of abdominal surgery, whether it's laparoscopic or an abdominal incision, it takes us a while to kind of feel a bit safer in actually doing those exercises, in putting a little bit of pressure on the tummy. And certainly for those who've had hysterectomy, putting any kind of tension through the stomach can be quite uncomfortable to start with. But obviously if you've had the surgery, you would have spoken to your physio in the hospital post-surgery before you came home, before you were discharged, and they would have probably given you a couple of exercises, maybe a sheet of paper with some exercises on for you to do at home. But I wanted to share with you the exercises that I was doing as a fitness professional, as a personal trainer, as a Pilates teacher after my hysterectomy, after my surgery, which I had done in November of 2019, and I had it through an abdominal incision, so it was quite an invasive surgery in terms of how much tissue fibre was cut through as they performed the surgery. And so you can relate this to your recovery. I had a hysterectomy with both my ovaries removed, my uterus removed, and my cervix removed, so literally everything's gone. And my recovery, I am now probably about 16 or 17 weeks post-surgery, and I started doing these exercises or adaptations of these exercises from around week 3 or week 4, just to really build up my pelvic floor muscles, make sure that I wasn't going to risk prolapse or any kind of damage in that respect. And I'm almost probably now, I'd say, as strong now as I was when I went into the surgery, if not maybe even stronger. So you can come back from this surgery, you can recover from this surgery. You just need to do it at the pace that feels right for you. So we all go through this surgery, we all go through this procedure in very, very different ways. Some of us recover very quickly, some of us take a little bit longer, but it's very important to be patient with yourself, be a little bit more forgiving of yourself as well. Don't expect too much too soon, because you can lead yourself into a bit of trouble if you over push yourself. And stay strong, you know, just be strong, just strong. Us women, we are very strong, so just kind of listen to your body, connect with your body, use your breath to open through your thoracic cavity, to engage your pelvic muscles, and don't do anything that's over tensing those pelvic floor muscles. So we may want to engage them and make sure they're functioning well, but we don't want to overstrain them, because that again can cause more pressure intra-abdominally, which we want to try and avoid. So all I want to do to kind of start you off is just connecting to your breath. So we're going to start laying on the floor, very, very simply. Just roll yourself down nice and gently, and just connecting to your breath. So just placing a hand on your just into the opening of your rib cage, and one hand down on your lower abdomen, and just take some nice breaths there. Just really relax and sink your back into the floor, and taking some breaths. So as you're breathing, I want you to try and think of a 360-degree movement through your ribcage, through your intercostal muscles, opening out through your ribs. So as you inhale, feel your ribs expanding open. Feel yourself almost pushing away from the floor, and each time you exhale, sink yourself in a little bit deeper. Just allow your body to melt down into the floor. Good. So we want to hold the tummy muscles a little bit. We have a little bit of pressure just to pull the spine into the ground. This is just going to protect your back a little bit. So we're not tensing the tummy muscles. It's not preventing us from breathing or talking, but just holding yourself into the ground so you're nice and relaxed. And then as you exhale, you're just going to float the arms up, take them overhead, and bring them back. And as you're doing this, just keep your back flush to the floor. And try and relax. Keep the shoulders nice and soft. Bringing the arms back down by your side, and you're just going to take one arm over. So just inhaling and bringing it back, and with the other arm and bringing it back. So if you're feeling a little bit tight through your shoulders, which you may be if you have been convalescing and just relaxing and sitting still after your surgery, reduce the movement. So you're not necessarily taking one arm all the way to the floor, but just move with what your body allows you. So if you're taking your arm to there and you're feeling your spine lift, then just stop there, bringing it back. But just try and keep that shoulder joint nice and soft, bringing it up. Relax the arms down here. Good. So with your feet flat on the floor, just taking a breath in and just tilt your pelvis towards the ceiling. So it's a very small move. Think about rolling your coccyx up so you're pointing your tailbone as far up towards the ceiling, maybe towards the wall and ceiling joint, and then roll it back. And then again, just inhale, tilt the pelvis up. And back down. Now if you're quite close to your surgery, so if you've had it within the last maybe 3 or 4 weeks, depending on how you had the surgery, whether it was laparoscopy or abdominal, depends on how much you might be able to do these movements. So it's best to just listen to your body, follow what your body is allowing you to do, and as you progress through the weeks after your surgery, you can start to increase these movements and make them a little bit more challenging or a little bit more opening towards your body. So at the moment, we're just trying to tilt the pelvis just to open up the hip joints, stretch the lower back, but also to just engage a little bit of this lower abdominal muscle and the pelvic floor, just gently easing up and back down. Again, like I say, if you are a few weeks post-surgery, you can start to roll the spine up. Now, even if you only come an inch or two off the ground and then roll back down, that's entirely up to you. It's how your body feels. But just try and roll each vertebrae up at a time. Control and then lower. And again, if you're a little bit further on in your recovery, you can start to bring this up a little bit higher, pushing into a full bridge. Again, it's really nice opener for the hips here, good for the glute muscles, but also using that pelvic floor. So try not to brace the pelvic floor, try not to grip, but just allow it to work and communicate with the other muscles around it. Using your diaphragm as you breathe, so as you use your diaphragm, it creates this push-pull canister with your pelvic floor, and you just want to try and engage those muscles as naturally as possible. You may find you're a little bit stiff through your lumbar spine, and that's quite normal after this kind of surgery. You know, we take on guarding patterns as we're recovering, when we're in discomfort. So we need to try and really tease open that lumbar spine, really try and stretch open the hip joints, and bring it back down. We'll go for one more. As we bring it down, just again bringing that spine, imprinting it into the mat. Now we're going to extend one leg towards the floor, keeping the other leg lifted. One of the things I really struggled with when recovering with my surgery was actually just bringing my thigh up in towards my chest and tummy. Obviously the swelling, the incisional site, it was all very, very swollen, very tender. So actually bringing your leg up can feel quite challenging. So what we want to try and do here is just bring the leg in as much as you can. Use the hand to support the knee or the shin, and just start to gently ease that leg in whilst keeping your back down on the ground. And we can gradually start to pull the knee in. So we want to try and create that squeeze through the abdomen, not putting too much pressure on the tummy. So if this is painful or sore in any way, just release it a little bit, just take it back to where you're comfortable. Now this is really good for digestion, because obviously after surgery, after anaesthetic, your digestive system is, to say the least, a little bit out of sync, a little bit up in the air and wobbly. So it's really good to work through movements that open up down through the digestive system. Obviously we need to keep the bowel moving nice and freely during recovery of hysterectomies. So gradually, just again, keep pulling that knee in, and as you progress through your recovery, you can start to do this just with a little bit more pull, just starting to get that knee up a little bit closer to your chest. And then exhale, we're just going to take that foot down and then slide it to the floor. We're going to bring the other leg up, and again, you might find one side slightly more tender than the other, but just again, working with what your body is capable of, what it's comfortable with. And we just want to gently, again, bring that knee towards the chest, just opening up through the body and just teasing it in. So just working with your comfort level. And what you might find with this is, as you're holding this position, even if you're still quite a distance away from your chest, that your body starts to realise it's okay, and you can gradually just ease it in a little bit more. All the time just breathing, opening those ribs, getting that 360-degree movement through your rib cage. As we exhale, we're just going to lower that leg down and then bring the other leg up. So making sure that you've still got that little bit of downward push into the floor. One of the movements I found really useful for my recovery and with my scar mobilization as well, so obviously having a 5-inch or so incision across my abdomen, was just doing some very gentle knee rolls. So these will start very small if you're quite early in your recovery. So just gently keeping your feet and your knees together and just gently rolling the knees to one side. This is as far as you, if this is as far as you can go, that's absolutely fine. Just gently roll back in to the other side. And again, as I said in the last movement, just listening to your body, just allowing your body to tell you how far it's happy to go, and just moving with your breath. So you're using that diaphragm to really open up and use that intra-abdominal pressure and that vacuum within your core to keep your pelvic floor moving. And again, as you move through your recovery, you can start to increase the size of these rolls, so just taking them gently further and further. And trying to keep your shoulders down on the floor. So as you start to open these further, keep your shoulders down on the ground, so you're not pulling your shoulder up and going diagonally. And then you can start to just turn your head the opposite way to your legs, just nice and gently opening the top of the spine with it. We tend to hold ourselves quite guarded when we're recovering, which can cause a lot of tension through the rest of the body. So not just within your abdomen, but through your back, your shoulders, your chest, your neck, even into your, like I say, your hips obviously, and then down through the legs as well. So we can end up quite stiff, partly from not moving around as much, not being able to lift and do certain even everyday chores that you would normally do, but also from the guarding patterns that we adopt whilst we're recovering. So these are lovely. They're really, really good at opening through the core, through the torso, through the tummy area, and they're really good for skull mobilization. So really good at sort of getting that twist and movement through the skull. You can also do this with a single leg, so you can bring one foot up very gently. This one is a little bit more tricky if you have had an abdominal incision, because obviously you're putting a lot of sort of squashing pressure down on that skull. But obviously if you've had a laparoscopic procedure, then this one might be quite a bit easier for you. But just again, go with what feels right for you. Just nice and gentle. And the other side. Bring that leg up. Bring the other side over. Now, one of the most challenging things I found when recovering was laying on my side. Not just laying on my side, but rolling onto my side. So it was probably the hardest part of any movement day to day, getting out of bed, getting up off the sofa. So if you can, bring yourself over onto one side. You can prop yourself up if you want to. It's entirely up to you, whatever you're comfortable with. Again, it's always down to just listening to your body. Now you can support yourself with your hand. You're trying to keep your knees and your feet in line with each other and have a nice straight line from your shoulders to your hip to your ankles. As you exhale, you just very gently open the hip and back down. So you're just doing a very, very gentle clamp. So we're just trying to open through the hip flexors. Engage the glutes a little bit, just get a little bit of work there. Nice and gently. Now if you struggle to do this one, if you're struggling to lay on your side, if you're quite early in your recovery, just skip this movement and start to introduce it when you feel comfortable on your side. It'll just start to feel a little bit better. You might find that you feel as though you've taken one step forward and two steps backwards sometimes, but just listen to what your body's telling you. Good, we'll go one more and then we'll swap to the other side. Good. And if you can, just nice and gently bringing yourself up, taking yourself over, bringing it to the other side. And again, you can prop yourself up if you need to, keeping your feet together. Gently just open. And again, you may find with this, one side is slightly stiffer than the other. What you want to try and make sure you're not doing is rolling off of the hip that's on the floor. So you're trying to keep your hips one on top of the other as you open up and not tilting your pelvis backwards. So you're actually using the right movement, the right chain of muscles in order to open. The movement doesn't need to be very big. It's actually just working within your limits, within your body's capabilities. Okay, nice and gentle. We'll do one more. And relax that. Good. Very gently, bringing yourself up into a seated position. Now, if you can, sit with your legs crossed in front of you. But if not, just find yourself a comfortable position. So however is comfy for your tummy, comfy for your body. Now we want to nice and gently just open out through the torso. So we're going to do a few more twisting movements. With this, you can just very gently take the arms out and just very slowly rotate over. Doesn't have to be a big movement at all. In fact, we don't really want big movements here. Just very gently, one side to the other. Now you can bring your arms to your chest here if you want to. It's entirely your decision. Some people like to fold their arms in front. This one I find gives me a nice stretch up through the latissimus dorsi up the side of the body. Over to the other side. And of course, sitting in this cross-legged position, it prevents that rotation of the hip girdle, so we're not rotating through the lower body. So it's always a really nice sort of thoracic opener through the spine, through the core. Now staying in that cross-legged position, just taking one hand down to the floor, one hand onto the other side. Exhale, just very gently lean yourself up and over. Again, you want to keep equal pressure on both of your sit bones, so you're not rolling your bottom up off the floor here, but you should be able to feel a nice stretch coming up from your hip, tracing up towards your ribs, and depending on how tight you are, you might feel it coming up across the rib cage as well. Gently up and over, and over to the other side. So again, remembering to keep the pressure down on both of your sit bones. Gently back up. And again. Okay, we'll go one more each way. And as we breathe, we'll just bring ourselves back to that seated position. And then taking the arms down by the floor, just inhale. Bring the arms up and just stretch your fingertips towards opposite corners of the wall. And back down. Good, and again, inhale. Open out. And down. Now you can bring this one up above the head, opening up through the torso, and down. Just stretching, just stretch and open what feels a little bit tight when you're doing these kind of movements, you know, just listening to your body, really sort of connecting in, connecting to the breath, connecting to the movement, and connecting to what your body's telling you, which is one of the most important things. So once we've done those, just resting the hands down into your lap, and again we're just going to do a few simple neck stretches. So just inhale, exhale, inhale, exhale, and just again follow that breath. Center, dropping the chin, back up, dropping the chin, four, and gently. So you don't want to force this movement, just let the head roll. Very gentle. On the center there, and just relax. So just taking a few breaths, and I hope that's helped. That's it for today. I hope that's helped to open up through your torso, make you feel a little bit better, maybe open the digestive system a little bit more, but certainly to open your lungs to breathe and to stretch open through the body and just get a little bit of skull mobilization, a little bit of pelvic floor function. But stay safe, stay within your limits. And I'll speak to you soon. Take care.